In this lecture, dear students, we will discuss the establishment of a closer relationship. The establishment and desirable closer relationship for removal of partial denture based on a functional harmonies in occlusion between partial denture and remaining teeth. Which is the major factor in preservation the natural teeth and their surrounding structures. Starting with the main categories related to the establishment of closer relationship is the centric relation. The centric relation, it is the most posterior relation of the mandible to the maxilla at the established vertical dimension from which lateral movement could be made. And this actually bone-to-bone relationship. So basically this affect our design and consequently affect the success of removable partial denture prosthesis. We also have the eccentric relation, which is the relation of the mandible to the maxilla other than centric relation that occur in horizontal plane, and these actually related to protrusive relation and lateral relation in terms of lateral to left or lateral to right relation. Now, the eccentric relation, as I mentioned, is any relation of the mandible to the maxilla other than the centric one, and the protrusive, of course, related the relation of the mandible to the maxilla when the mandible is thrust forward. That means the retraction of the mandible. We have also the centric occlusion. In terms of centric relation, bone-to-bone relation. In centric occlusion is the tooth-to-tooth relation. It is the maximum intercuspation between the upper and lower teeth. The latest terminology for centric occlusion is the intercuspal position. So, if we said the intercuspal position or maximum intercuspal position, this refers to centric occlusion as well. Now, the establishment of the occlusion in removable partial denture also related to occlusal harmony and occlusal disharmony. And the occlusal harmony, a condition in centric and eccentric jaw relation in which there are no interceptive or deflective contact of occluding surfaces. Okay, now the occlusal disharmony, this is a phenomenon in which contacts of opposing occlusal surfaces are not in harmony with other tooth contacts and or the anatomic and physiologic components of the craniomandibular complex. So this is related to the occlusal in terms of the position of the teeth within the arch itself. The working side and the balancing side. The working side, the side toward which the mandible moves in a lateral excursion, and the balancing side on the non-working side, of course. And this is really affect the successful prosthesis as in removable partial denture, as the contacts should be consigned in terms of compensating the intercuspal functional process. With the reason that may lead to failure of adequate occlusion of removable partial denture, we have probably the lack of support for the denture base. So if the denture base with the removable partial denture lacks support, this will affect the adequate occlusion. We will have a disocclusion related to this. So all the denture base borders should be perfectly seated on their sulcus, if this away from the movable tissue, like in the lower denture, when the flanges are away or cannot be affected by the raising of the floor of the mouth. Also, the falsity of the established occlusal to single static jaw relation recall. That's mean during the recording the jaw relation, the vertical and the horizontal. Sometimes the patient with few missing teeth, there is a falsity in establishing occlusion, in static jaw record. So there should be functional movement to record the jaw ratio record. Or we have also the other reason, which is unacceptable occlusal plane. And this affect, of course, the design of removable partial denture, which consequently affect the success of the denture. Now, the establishment of satisfactory occlusion for removable partial denture should include many factors regarding, first of all, we should analyze the existing occlusion to find out if it is possible to create or to construct a removable partial denture for such a patient. And if not, so we have a substitute for this case. If we can, so the correction of the existing occlusal disharmony is essential. Sometimes we need to extract many teeth if there are unsound or in terms of mobility of teeth, or we need, for example, to a few ortho treatment for few months to correct teeth in improper position if they are sound and healthy. Now, also recording of the centric relation or an adjacent centric occlusion is essential to establish a satisfactory occlusion with removable partial denture. Now, we should harmonizing centric jaw movements for a functional eccentric occlusion to make sure that the denture under function are really satisfying the functional purposes beside the aesthetic as well. Now, correction of the occlusal discrepancies created by the fit of the framework and during processing of the removable partial denture is essential as well. Now, what we have with the desirable occlusal contact relationship for removable partial denture, we have many points to highlight. Following occlusal arrangement are recommended to develop a harmonized occlusion relationship among removable partial dentures and to enhance stability of the removable partial denture. Okay? Now, first of all, simultaneous bilateral contact of opposing posterior teeth must occur in centric occlusion. This will give a stability for the denture. Then the occlusion for two supported removable partial denture may be arranged similar to the occlusion seen in a harmonized natural dentition. Because the stability of such removable partial dentures results from the effect of direct retainers at both ends of the denture base. Now, the bilateral balance occlusion in eccentric positions should be formulated when a maxillary complete denture opposes the removable partial denture. Now, this is accomplished primarily to promote the stability of the complete denture. However, simultaneous contact in a protrusive relationship do not receive priority over appearance, phonetic and or a favorable occlusal plane. So this is the essential thing to do with. Now, working side contacts should be obtained for the mandibular distal extension denture. These contacts should occur simultaneously with working side contacts of the natural teeth to distribute the stress over the greatest possible area. Masticatory function of the denture is improved by such an arrangement. Also, simultaneous working and balancing contacts should be formulated for the maxillary bilateral distal extension removable partial denture whenever possible. Such an arrangement will compensate in part for the unfavorable position. The maxillary artificial teeth must occupy in relation to the distal residual ridge. However, this desirable relationship often must be compromised when the patient's anterior teeth have an excessively steep vertical overlap with little or no horizontal overlap. Even in this situation, working site contacts can be obtained without resorting to excessively steep occlusal inclination. Uh, then only working contacts need to be formulated for the maxillary or mandibular unilateral distal extension, removable partial denture. Now, balancing side contacts would not enhance the stability of the denture because it is entirely too supported by the framework on the balancing side. Then, for example, we have many cases when the blunt and intercuspal position in different way. Uh, as in Kennedy class 4 removable partial denture configuration, the contact of opposing anterior teeth in the blunt intercuspal position is desired to prevent continuous eruption of the opposing natural incisors. So, if we have a natural overbite and overjet, we probably will reduce this or provide a contact between them, unless they are otherwise prevented from excursion by means of a lingual plate, for example, or auxiliary bar, or by splinting contact of the opposing anterior teeth in eccentric positions can be developed to enhance incisive function, but should be arranged to permit balance occlusion without excursive interference. Now, the artificial posterior teeth should not be arranged farther distally than the beginning of the sharp upward incline of the mandibular residual ridge or over the retromolar bud. This, to do so, would the effect of shunting the denture anteriorly, then a harmonious relationship of opposing occlusal and incisal surfaces alone is not adequate to ensure stability of the distal extension removable partial denture. In addition, the relationship of the teeth to the residual ridge must be considered. Okay? Bilateral eccentric contact of the mandible distal extension removable partial denture need not be formulated to stabilize the denture. Now, the buccal cusps, however, must be favorably placed to direct stress toward the buccal sheath, which is the primary support area in the mandibular arch in such positions. The denture is not subjected to excessive tilting forces. On the other hand, the artificial teeth of the bilateral distal extension maxillary removable partial denture often must be placed lateral to the crest of the ridge. Such an unfavorable position can cause tipping of the denture, which is restrained only by direct retainer action on the balancing side to enhance the stability of the denture. So it seems logic to provide simultaneous working and balancing contacts in this situation, if it is possible, of course. Now, we have many methods to establish a closer relationship. And we're going to start, for example, with the direct position of the cast. 5 methods of establishing a closer relationship for removable partial denture, starting with the direct opposition of cast. This method used when sufficient opposing teeth remain in contact to make the existing jaw relationship obvious, or when only a few teeth are to be placed on short denture bases and no evidence of occlusal abnormalities is found. So this the direct opposing of casts will be established. One of the methods to establish a closer relationship, and this with few missing teeth. In terms of few missing teeth. Secondly, we have the interocclusal records with posterior teeth remaining. So these teeth probably act as a lock to the intercuspation. Now, this method is a modification of the first method used when sufficient natural teeth remain to support their movable partial denture. Uh, for example, in Kennedy class 3 or 4, but the relation of the opposing natural teeth doesn't permit the occluding of the cast by hand. A class 3 or class 4. No. In such situation, jaw relation must be established as for fixed restoration with some type of interocclusal record. Just in these cases. Now, also we have the occlusal, one of the methods to establish occlusal relationship is the occlusal relations using occlusion rim on record base. And this is what we are normally used to record the occlusal relationship. Now, used when one or more distal extension areas are present, so in terms of class 1, class 2 as well. When a tooth-supported edentulous space is large or when opposing teeth do not meet. So we need to use this method to establish a closer relationship. In these instances, occlusion rims on accurate jaw relation record basis must be used. The other method is the jaw relation record made entirely on occlusal rim. And this, of course, after the construction of the metal substructure, removable partial denture framework, and then the bite will be taken to arrange the artificial teeth. Used when no occlusal contact occurs between the remaining natural teeth, such as when an opposing maxillary complete denture is to be made. Concurrently with a mandibular removable partial denture. It may also be used in those rare situations in which the few remaining teeth do not occlude and will not influence eccentric jaw movements. Now, the last method is the establishment occlusion by the recording of occlusal pathways. This method is a registration of occlusal pathways and the use of the occluding template rather than a cast of the opposing arch. And in this way, there are many movements taking for the mandible to make sure that the registration is perfect with occlusal pathways. This lecture is a little bit constrained, so I would like from you, dear students, to prepare the quiz for next week to find out what are the reasons that may lead to failure of adequate occlusion of removable partial denture. Until that time, thank you very much and take care.